All right, good morning, folks. Hopefully you guys can hear me. I see Dr. Balakrishnan is here.
Hi.
There you are. Good. Well, good. I don't even want to know what time it is. Where are you at? What time? It's interesting. You're in Singapore. Is that right?
No, Sean, I'm in Perth.
Oh, you're in Perth. Well, you're still in a crazy time zone.
Yeah, it's just after midnight.
Oh goodness. Well, sorry about this. Goodness. Well, thank you so much
No
for
problem.
coming up late and doing this. I was kind of looking into your background. I had the opportunity to travel to Malaysia 2 years ago to give a lecture about this crazy carnivore diet, and it was an
Okay.
interesting time. So a little bit familiar with the part of the world you're from, but first of all, like I said, thank you for being here, and particularly at midnight in Perth, Australia. Let me ask you, if you don't mind, just to give us a little bit of your history for folks that aren't familiar with you and what you do.
Yeah, I've been a doctor for about 20 years now, 21 years, and I trained as a family physician. I trained in Singapore. I worked for several years in Singapore, and then I relocated to Perth, Australia, because I love the Australian way of life, and I've been here now for about 7 years. 7 years, and yeah, that's me. And I've been on a carnivore diet for close to about 3 years. 3 years now, and I started off being a low carber. Just after 2005, and that's because I wanted to make sure I do not become a diabetic. So I was trying to find out how I can prevent myself from becoming a diabetic, and I stumbled upon Dr. Andreas Enfeld's website, the Diet Doctor, and then just one thing led to another, and then it was just like a slow transition, and I found myself one day being a carnivore.
Yeah, that happens to a lot of us. It's kind of a bit of a trap, but I say that kidding. I think one of the things you said, you did not want to become a diabetic, and I think probably if we look at the Singapore, Malaysia, a lot of Asia is becoming diabetic, and traditionally that wasn't the case. And so if we listen to certain folks in the US, they would say, well, if you don't want to be a diabetic, for God's sake, don't eat meat, because meat causes diabetes. I see that, and it makes me sort of I kind of smile, but at the same time, that is a message that a lot of people seem to hear. So how do you sort of bring those two things together? I'm eating meat, but I don't want to be a diabetic.
No, because the thing is, as you rightly pointed out, the Asian diet, which largely consists of processed carbs or refined carbs like rice and noodles, yeah, and bread, and we all grew up eating food like that, and we think that we cannot dissociate ourselves from food like this. But going just to the basics of how this food behave in our body, it's quite easy to see how, if you do not limit or remove these types of food from our diet, we will end up being a diabetic eventually. And that is why the incidence of fatty liver disease, diabetes is just rising it's just rising in Southeast Asia. And your point as to the so-called link between consuming meat resulting in type 2 diabetes, or some of the studies that showed if you eat too many eggs, and that's going to increase your risk of diabetes. So when you look at the studies that showed or so-called prove this link, it is all based on very weak epidemiological studies. And I still have patients coming and say, hey, wait a minute, if you are telling me to eat this way, what about this paper that was published a few weeks back saying if I eat meat, I'm going to get cancer. If I eat meat, I'm going to get high cholesterol levels. And so it takes a lot of work, effort, to just make them understand where all this misinformation is coming from.
Yeah, it's definitely an uphill battle you have to fight. Like I said, when someone puts out information that's incorrect, it takes you 10 times as much effort to sort of sort of convince people otherwise. You'll be, I guess, maybe happy to know, I just saw a preprint from Harvard University in a study looking at 2,000 people doing a carnivore diet. And I think in that cohort, they had about 262 diabetics, and something like 92% of them came off fully off insulin, 84% fully came off all their oral medications, and 100% came off any other injectable medications. So these would be some like, maybe the GLP-1 agonists and some of these other injectables that are out there. That is, to me, pretty impressive from a dietary intervention. I mean, I don't think there's anything that works as effectively as that I'm aware of, but that's pretty interesting to see. You are an internal medicine doc. You're an internist, I assume. Is that correct?
No, I'm a family physician.
GP. Okay, never mind. Okay, so similar. You see everything. You treat everything and see everything. Are you attached to a hospital, or you do a clinic-based practice?
I work in a private clinic, in a private practice, and yeah. So I've been there for about 7 years, and all these things that you're saying, about this carnivore diet is still quite. I mean, it's relatively still new for Australians, and but the idea is catching up, and people come to me saying, hey, I've been on this carnivore diet for the last few months, few years. My doctor is not supporting me, so how can you help me? So that's where I come in, and I just help them, just guide them on this diet, make sure that their blood pressure is fine, their blood works are all okay, and reassure them that what they're doing is right.
What is the population that you serve there? Are you serving a population that's, well, I mean, I guess you can't get away from this now, but a lot of metabolic issues. Do you have a particular population that you tend to see? Older people, younger people? What is your group?
Yeah, I see all across the age groups, but I mostly see patients between 15 and 55. That's my largest cohort. And maybe 10% of my patients are like above 65. And but the people who are mostly doing this diet are like above 30 and above, and a handful of them are above 60.
Yeah, I think one of the things people use it to fix things, because I think if nothing feels bad, there's nothing wrong, then people are going to continue in the habits that they're at, whatever they enjoy, whatever tastes good. And I think and not that a carnivorous diet can't be absolutely delicious, I find it to be very good. But other interesting thing from that Harvard study, the oldest person in the study was 85 years old, and the longest person that had been doing a carnivore diet has been doing it for 337 months, which is about 30 years, which I thought was quite impressive. And so there's certainly, for people to say it's not sustainable, you've got people that have been doing it for 1, 2, 3 decades or more. So that's pretty cool to see. As you, I guess, like myself as a physician, I didn't give much thought to nutrition, particularly when it came to disease management, because we just weren't really taught to do that until my own health started to have issues. That's when I started to look into nutrition and some of these other things. I'd always been an athlete, but I got to a point where it didn't matter how much I exercised, there were health issues that started to crop up. Did you have a similar sort of concern? I know you said you didn't want to get diabetes, but did you notice a difference in as you progressed through your different diets?
Yeah. So initially, several years ago, when I was training, I was working in the hospitals, and all I ever did was, for a quick meal, is just eat rice 2-3 times a day. And I did not realize that I was gradually putting on weight. My waist was getting larger, and I was developing man boobs. And then one day I was posted to I had to sit in with an endocrinologist who was going to teach me how to manage diabetics. And that's when I saw myself in all these patients coming in. After a few days, I said, hey, wait a minute, I'm going to end up like this poor patients one day, and that's where I do not want to end up. And I tell this to a lot of people, because I noticed this pattern. The patient will come in, their blood sugar levels will be elevated, and endocrinologists will increase their medication, the dosage of the medications, or increase the dosage of their insulin. And then they'll be told to go and see the dietitian. And when they go to see the dietitian would say, oh, so your doctor has increased the dosage of your medicines, so you need to eat more carbs. And 3 months later, the patient will come back, and the same conversation, the same thing will continue, where the doctor will increase the medicines, go and see the dietitian will say, eat more carbs, and it just goes in circles. So I thought, hey, I am going to be like them one day. And that's how I got into this area of nutrition, how to eat healthy. And it was a transition, because first you think, oh, brown rice is good. Then, you think, oh, black rice is good. Then you realize, hey, wait a minute, all rice are just as bad, right? And from white bread, you go to whole grain bread and things like that. So that was my purpose. That was my motivation to get into this research or business of eating healthy and finding out how I could stay healthy and not become a diabetic. And when I saw how it, I lost several inches of my waist. I just kept losing weight, and I started looking good, looking better, feeling good, and my family members were saying, "Hey, you're looking healthier, looking younger," and yeah, so that's how I knew that I was on the right path. And I kept all this knowledge to myself for several years, because it's not easy to convince people that the food that they are eating or they think is healthy for them is really not that healthy or all that great as it is made out to be. But eventually, my wife saw what was happening to me, and she came on board too. So we're all carnivores now.
It's interesting because you discuss rice, and you hear so many times, look at all these healthy people, they live in Asia and eat lots of rice, but there have been a number of recent, and again, these are associational studies that look at rice consumption and incidence in type 2 diabetes. And when you eat a lot of rice, the incidence of diabetes is noted to be higher. So there may be a limit to how much you want to eat, for sure. And perhaps for some people, it's a frank problem. What is the climate like, I guess, in Australia, I guess maybe in Perth right now for, because in the US system, it's very much there's a lot of private payer stuff. And so the incentives are not so much to necessarily take time, do lifestyle type stuff. It's more, geared towards getting through a high volume of patients, and then ideally, from a hospital perspective, doing a lot of procedures and generating a lot of revenue. Is Australia similar to that, or do you have a little more laxity or freedom to sort of take the time and really focus on lifestyle?
So because I work in a private clinic, so I have the luxury of spending time with my patients and giving them alternatives. So the message out there is still very much the same. If you have diabetes or any metabolic illness, treatment, medicines are the way to go. Medicines are the way to go, and that's always been the case. But there are very few of us here who are taking the time to provide an alternative. I tell my patients, look, we can treat you with medications, but if we were to go to the root of the problem, then we have to address your diet, because it is the diet that's making them unwell. And a lot of people actually, they really do not fancy or like going on medications. And I think if we give them a chance to use diet to improve their metabolic health, most of them are willing to give it a try. And when they start noticing the improvements in their blood works, that motivates them to continue. And so because I work in a private clinic, and patients are not rushed in and rushed out, I have that opportunity to provide them alternatives.
Yeah, I mean, I know in Australia, I know of at least, and I've had conversations, interview with several folks from Australia. Paul Mason, I think, who's in Sydney. Gary Fettke is somewhere in Tasmania, and then Pran Yoganathan, who I think he might also be in Sydney, but I'm not sure. But that are diet based, and they tend to be meat or carnivore based, or at least they're advocates of that for their patients. So we're seeing a little bit. Do you so let me ask you this question, with regard, because you mentioned metabolic health or metabolic syndrome, metabolic disease, how quickly does that respond to lifestyle in your experience?
Oh, I've had a few patients who were okay. So the earliest sign of metabolic illness would be their raised liver enzymes or high triglyceride levels, as you probably know, as you already know. But if the I've got a few patients who were so determined to reverse these conditions, and we have seen results as quick as 6 weeks. If they completely eliminate the bad food, carbs, and eat real food, I've seen the liver enzymes and triglycerides improve within 6 weeks.
Yeah, and I've seen similar. I've seen people, diabetics, that their blood sugar will respond within days. Quite honestly, their insulin requirements, if they're insulin dependent, whether type 1 or type 2, dramatically plunges within days, and even long before any weight loss might occur. And so one of the things is, as I mean, everybody knows we're in this worldwide pandemic, and one of the things is, there's a host factor that clearly influences how sick people get, and honestly how sick the population gets. Is there, I don't live in Australia. I see some of the messaging coming out of Australia. Some of it's a little bit disturbing, quite honestly. But is there any kind of messaging about getting healthier during all this? Is there like a national campaign to get people healthier at the same time, or is it more just, here, take a, do these social measures?
Unfortunately, Sean, I think just like everywhere else, we are not focusing on being healthy or improving your immune system or being metabolic healthy. There's no focus on that, and that's really quite disappointing. But I think that's quite similar to other countries like UK, the US. There is no focus on advising people to stay healthy or become healthy. That message has just is lost. No one's focusing on that anymore.
You wonder, I mean, as a physician, this whole profession in theory is about getting people healthy. I mean, that's what we're supposed to do, but we don't seem to have any buy-in from the powers that be, I suppose. You're kind of if you do that, you become kind of almost kind of an outcast a little bit, to be fair. I mean, I think that's unfortunate. So let me ask you about this, because this is from the provider standpoint. I mean, a lot of, when we talk about medicine, we're always patient focused, but there is certainly a lot of people in medicine that have become dissatisfied with it for various reasons, whether it's administrative stuff. In the US, there's a lot of administrative hassle and insurance company hassle, and the focus has become on the business side and not so much on the art of medicine side. Do you get more satisfaction now that you've included nutrition and lifestyle in your practice than maybe what you did 10 years ago?
Oh, certainly, Sean. Certainly, it's so motivating and satisfying when a patient comes in and say, "Hey, I followed the diet you told me, and here are my results." It's what keeps me going. Seriously, when you help somebody come off their insulin, or you help a diabetic come off all their medications. I have a few patients who have done that, and it's so motivating. It really lifts you up when you're having a long day, a tiring day, and then this guy comes in or this woman comes in and says, "Hey, I did this," and then you are reminded why you became a doctor in the first place. It's to help people like this. You can see 20 patients a day, but that one patient that comes in and says, "Hey, I did this, and look at my blood sugar levels." It makes my practice more satisfying and more rewarding. And yeah, you're absolutely right. It's very rewarding.
Do you have, are you, I mean, are you within a group? Are there other providers with you that you maybe interact with and talk about this stuff
Yeah,
too?
in our practice, we have about 8 or 9 doctors, and there are 3 of us, including myself, 3 of us who advocate this low carb lifestyle and alternative to help patients with metabolic conditions.
That's, I mean, that's great to hear. It's good to see more and more of that. And you know, I continue to see popular media headlines saying that, you know, low carbohydrate diets are both dangerous and unsustainable, and you know, they're going to lead to more chronic disease, and yet you're seeing the exact opposite. How do we sort of make sort of some sort of, how can we intelligently navigate the disparate messages out there?
Oh wow, yeah, that's a tough one, because the message from the other side is in abundance, right? You know, everybody is trying to people are trying to get a lot of people to go onto a plant-based diet, and the messaging for plant-based diet is so strong, so powerful. It's across so many platforms, and us on this side, you know, who try to bring some balance to the debate. You know, we are just outnumbered at the moment, Sean, and it looks like you know, we have a tough job ahead. I have no idea how we are going to consolidate all this and get the message out, because telling someone, like, you know, a plant-based diet is all not that great is quite quite difficult, and it's easier to tell someone that meat is bad for them than telling them a plant-based diet is bad for them. They look at you and, okay, have you gone crazy? But yeah, but I think we are slowly starting to fight back. Like the meat industry here is trying to get the message out. I was very happy to see our meat industry here supporting our Olympic athletes. So that you can see advertisements on TV where message that the meat industry here is supporting our Olympic athletes. So that message was there. You know, it was nice to see that. But I think that the meat industry has to also counter all this propaganda from these plant-based giants.
Yeah, and you know, I mean, to be honest, the meat industry is, I mean, they're not poorly funded. They're a $1.3 trillion industry worldwide, and so they have the ability to do that. And I've seen some of those Australian commercials. You know, the one with the boy and the girl and the dinner table. One's the Olympic athlete, and the other guy's doing some silly game. And it was a funny commercial about beef, and you know, some people took offense to it, but thought it was misogynist or something like that. I thought it was kind of silly, but and I've seen a couple. I mean, there was one in, I think it was looking at the different provinces, and it was like Queensland versus New South Wales or something, and somebody's breaking through a wall because they hand them a lamb chop, and it's that was another funny commercial that's, you know, that farmers are ranchers, but we're not seeing that in the U.S. to this degree. I mean, we have a beef industry that has largely been silent with you know, promoting itself, and I just wonder why that is. But I mean, back to the, you know, the side of, you know, getting the message out there, and are you, I mean, Gary Fettke, you know, was threatened with his equivalent of license, his registration, by telling diabetics, hey, maybe you should cut back on the sugar so I don't have to cut your leg off. And I cut off a lot of, you know, I cannot tell you how many hundreds of amputations I did in my career, you know, legs, toes, feet, fingers, you know, and all kinds of horrible infections in diabetics. So we know that's there. And, you know, you could literally take a diabetic and cut their leg off, and they still don't want to change their diet. I mean, they're still, I mean, that's how powerfully hooked they are in this stuff. And so it's an uphill battle, but we're seeing, we're starting to see, you know, really within the last year, some censorship of dissenting opinions in a number of topics, whether it's around the pandemic response, whether it's around politics, and now it's starting to bleed over into nutrition to some degree. Are you concerned about that as a physician, being able to have freedom of thought and speech and discourse?
Yes, So I was initially afraid and quite fearful of giving out this advice to my patients. It was Gary Fetke who told me, who encouraged me not to be afraid. I met Gary about 4 years ago at one of the meetings in, I think it was Sydney or Melbourne, and I met him. And so he told me, look, they've already gone after him, and they're not going to come after any one of us, because I think he gave them hell. So I owe it to Gary for giving me the confidence and encouraging me to give out this diet, this advice. So to answer your question, at the moment, I'm not afraid, because I see the results. My patients are there to tell me, or to back me up, that what we are doing is not wrong. What we are doing is working. What we are doing is improving their lives. They're getting better without depending on medications. And if our ultimate goal is to keep our patients healthy and avoid complications, then they should not be going after us.
Yeah, that would seem to make sense. I mean, we certainly would agree with that. So let me ask you about your approach to how do you convince someone to give this a try? Because not everybody wants to hear about diet. Many people just I had patients, I don't want to hear about that. Just give me my shot. They didn't want to hear anything. How do you walk patients through this?
So Shawn, I mean, basically what I do is, it's all about giving them options. The first thing I do with them is I want them to understand. I want them to understand that medicines are not the only solution, right? And managing metabolic diseases starts with improving our lifestyle, and that is something a lot of us have forgotten to pay attention to. We just just quickly write medications, prescriptions, and give it to the patients. So I let my patients know, look, you can start with, you can treat your conditions with tablets, medications, or we can help improve your lifestyle, improve your diet, improve your physical activities, and help to control your condition without depending on medications. And you're right, a handful of patients will say, oh, this is too much effort for me, just give me the tablets. But I would say about 70% of my patients, especially those recently diagnosed diabetics or recently diagnosed with fatty liver disease, they are quite keen. They're quite keen to use the information I give them to improve their diet. A big stumbling block is the conflicting messages out there. So when you first tell them, this is what you need to do to improve your health or your metabolic condition, they say, hey, but wait a minute. I read that I can have whole grain food, I can have high brand cereals, I can have banana milkshake. So over a few visits, it takes a few visits to convince them that improving their diet will play a large part of their large part of their treatment plan to get them to become better.
Yeah, do you see that any differences in different categories of patients responding differently to diet? Like I just say, we sometimes see that perhaps menopausal women respond differently to one diet than young men. And I mean, are you seeing any patterns in how people seem to respond, or does everybody seem to do well on a standard low carb diet?
No, a lot of them, many of them do quite well on a low carb diet. If you can't see it on them, at least their blood works will show the improvement. I've had one or two patients who just did not do well, or not do well. They did not show any improvement while going on a low carb diet. But I've seen all of them improve if they went on a carnivore diet. That's no doubt.
Yeah, I think it's just a little bit more powerful version. I think whatever you're trying to accomplish, that I think the carnivore diet is probably the most aggressive tool that you have. Not that everybody has to do that, but it certainly is. I think that's in my experience, that's been the most powerful intervention you can do. Let me ask you about, because you said you want to, when you do treat people that are on low carb diets, and you want to make sure everything's going okay, and you look at their different clinical factors and blood work. One of the things that always comes up, and I've had this discussion, I don't know, hundreds of times, but some people are going to see an increase in LDL cholesterol. Some people don't. Some people like to see it go down. What do you do with those people that come in and say, hey, my LDL cholesterol went up 40%. What am I going to do? Do I need to quit the diet? How do you manage that?
So the funny thing is, a lot of the patients who come to me, they already know about this controversy between high LDL and its weak association with ischemic heart disease. So they already know, they've already made up their minds. They do not want to be on a statin or any treatment for it. But a handful of the patients who come in, and when we look across all their blood works, they've got good ALT, gamma GT levels, they've got very low triglyceride levels, and their HDL cholesterol is like above 2, and so I give them some literature to read. Hey, now you've got this literature. So I use literatures by Dr. Nadir Ali, and some by Dr. Asima Holtra. So I show them, look, these are the literatures written by cardiologists who are showing that the LDL is not the only reason. The high levels of LDL are not the only reasons that can lead to ischemic heart disease or poor cardiovascular outcomes. It's looking across the board, and a lot of people are aware that there's a weak link between this LDL and heart disease. That message is already out there. So again, I get patients coming to me saying, look, my doctor wants to put me on a statin. I do not want to be on a statin. Can you help me? So I also attract patients like that. So I don't force them to take a statin or come off a statin. I give them the information they need. Just bring some balance to the debate and ask them to decide what they want to do. And most of them say, no, they do not want to be on a statin. And in fact, a lot of them do not want to be on a statin if once they know what are the side effects involved by going on to a lipid lowering medication. They rather improve their diet than go on a statin.
And what you said when you look across the board, so what are the things you're looking at? Obviously, in a standard lipid panel, you're going to be looking at both triglycerides and HDL levels, but how do you sort of is there a comprehensive way you look at it? Because the statin, whole purpose of the statin is to avoid cardiovascular disease or to mitigate or limit it. So how do you stratify people based around cardiovascular disease? What do you look at?
So it's looking at the individual. If you've got a person who is slim, doesn't have a lot of, doesn't have any central obesity, they've got a good blood pressure, their blood sugar levels are good, their ALT or gamma GT is really low, their triglycerides are low, they are non-smokers, they are people who are physically active. And so these are the people, I think, who are already at low risk of cardiovascular diseases. And these are the people who may not benefit from any lipid lowering medications. However, and sometimes, these individuals with high cholesterol levels would say, I would offer them to get a calcium CT score, a coronary artery calcium score, to help them make decisions. So we get patients like this, we have a very, very low calcium score. And that's another a piece of information that helps me and the patient decide if they need to be on a statin or see a cardiologist. Because I think that there is still a role for statins in some individuals who are at high risk. maybe not by lowering the LDL, but by making the plaque more stable, pleiotropic tropic feature of a statin. But yeah, so sometimes I use the coronary artery calcium score to help decide.
One of the unique things about, with this carnivore diet is that it seems uniquely effective compared to perhaps other dietary strategies for things like inflammatory bowel disease, for some certain autoimmune disease. I think that's where it really shines above some of these other diets. I mean, there's a lot of ways to lower your blood glucose and, lose weight. Clearly that's the case. But are you seeing that as well in your population? Do you see many of those people coming in with Crohn's and ulcerative colitis and psoriasis, and are you able to see any improvement with diet?
Yes, Sean. I have about 4 patients who have Crohn's disease and ulcerative colitis. They are on this carnivore diet, and they have come off their medications, and they are doing very well. I've had patients with fibromyalgia who are on the diet who are doing very well. I've also got a few patients who have stopped taking the antidepressants because their depression has just gone away. And and I've got patients who are on the diet whose migraines have gone away. Their psoriasis is in remission. And yeah, so the carnivore diet seems to work across the board.
Yeah, that mirrors my experience from what I've seen. I've seen a lot of this stuff. And one of the things, so I'm just wondering, as far as objectively looking, like particularly like these Crohn's patients, where sometimes they'll have serial, colonoscopies or other, objective markers, maybe looking at fecal calprotectin or other inflammatory markers. Are you seeing not only the symptomatic relief, but are you seeing some objective things you can point to and show another colleague that these things are clearly getting better?
No, Sean. We patients with these inflammatory bowel diseases, it's just them coming to me and saying, look, my symptoms have gone away. I don't need these medicines anymore, and I'm going to stick to this diet. So those, I mean, that's the feedback I get from my patients. But if we look at numbers or parameters like that, then it's going to be my diabetic patients. I've had patients who've had very high glycated hemoglobins, like 10, 11, 12. They've been able to bring those numbers down to normal levels within 3 months. So these are the ones that I have many patients who have done that. So that's the information I show my colleagues, and and tell them, look, we have to offer this option more to more often to our patients.
Let me ask you, first of all, congratulations on getting people to even to talk about this stuff. But what I find is, having them implement it and supporting them along the way is an equally and extremely necessary part to get compliance and to have long-term success. Do you have any additional ways to sort of support patients? Do you send them to somebody? Do you have a website? Do you have literature? Do you have a way that they can kind of, because a lot of people come when they get questions and things come up and they need someone to talk to. So how does that work for you?
Yeah. So usually when the patient comes to me, I spend a lot of time with them explaining what we have just discussed. And I'm in the midst of coming up with a website to help our patients here in Western Australia. And at the moment, I'm using literature from a diet doctor. I use the literature by the Public Health Collaboration UK, all those sugar food charts by Dr. David Unwin. And I'm using some of your material, Paul Saladino's materials, material like that at the moment.
Yeah, speaking of David Unwin, just came out with a nice study I saw just got published looking at, I'm sure you might have seen that, higher protein, low carb diets and actually reversing chronic kidney and renal insufficiency. So we're seeing, GFRs go up, which is, obviously opposite of the message we've been hearing for decades, that protein damages the kidneys, which is not really based on anything. It's more, again, it's associational, standard Western diet kind of nonsense epidemiology. But let me ask you that, because if you're recommending people eat more meat, are you concerned about their kidneys in any way?
Oh no, 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 certainly not, because I mean, if we go deeper into the basics, if you look at the kidney, right, the kidney is an organ that has evolved over millions, billions of years. The kidney can deal with protein, right? The kidney can deal with protein. What the kidney can't deal with is this modern food, this highly processed, refined, standard Australian, standard American diet. That's what the kidney can deal with, not protein. I mean, a carnivore diet, a diet based on just eating pork, lamb, beef. Here we have kangaroo and all. I mean, come on, the kidney can deal with that. I've not seen anybody's kidney function, renal function worsen or deteriorate by having more proteins in their diet. And in fact, you think about it, when people eat protein like this, they eat less often. They eat less often. They have like 2 meals a day. They have 1 meal a day, and the kidney copes very well.
Yeah, that reflects experience. In fact, yeah, I've seen a number of people with chronic renal insufficiency, sometimes even advanced disease, actually recover and improve. And there's actually some studies out there that are supportive of that if you look for them. Do you find that do you have much exposure to the indigenous populations there, the Aboriginals? Is that part of the folks in Western Australia that you may treat? And do you see I see, when I used to practice a lot in Western New Mexico, where there's a lot of Navajo people, they've just been decimated. I mean, disproportionately decimated by this modern diet. Are you exposed to those folks as well? And do they buy into these, sort of more ancestral diets?
Yes. So Shawn, you're absolutely right. We have the same experience here. I mean, I do not see many indigenous patients, but I saw many of them when I was working in the hospitals, and they are a population that just cannot tolerate our Western processed food. You would see teenagers, you will see them in their teens already having vascular diseases, metabolic diseases. They may look slightly overweight, but metabolically they are very unhealthy, and they just can't tolerate diet, this Western diet. But in my clinical practice right now, I see very, very few of them. So and I don't have much experience working with them anymore, because I see a handful, because where I work, I don't see many of them. But metabolic diseases in our indigenous population here is quite high. It's quite high. And I think it's the same, like you mentioned with the Navajo Indians.
Yeah, that seems to be any sort of population that gets really late exposure to the Western diet seems to be just, whether it's Pacific Islanders or Native Americans or Aboriginals. That's in Australia. That seems to be a really big recipe for awful population health. Do you, you mentioned antidepressants. There's a lot of people out there that seem to think that diet has no role in mental health disorders. I mean, would you agree with that, or what are you seeing with diet and mental health? I mean, is the brain actually an organ that responds to our physiology like any other organ in our body?
Yes, certainly, Shawn. I mean, I forgot to mention earlier, I use a lot of literature by Dr. Georgia Eid. She's got a fantastic website where she talks about how food, our diet influences our mental well-being. And I completely agree. What we eat influences how we feel, and I've seen that in my clinical practice. And I've started to advocate a carnivore diet for my patients who are depressed or anxious. Again, it takes a lot of effort to convince them to try out the diet. But I'm glad Georgia Eid has so much information on her website, and so I'm directing my patients to her website to learn more, and hopefully we get more results from them.
Yeah, I think, I've met and talked with Georgia many times. She's a wonderful resource and a great advocate. And also, I don't know if you're familiar with Chris Palmer. Chris Palmer is a psychiatrist at Harvard, is doing quite a bit of work around ketogenic diets and low carb diets and things like schizophrenia and other mental health disorders. And it's got some really, really amazing information as well. So those are always great resources. Where do you feel that this message of metabolic health is going? Are we starting to make a difference? I mean, we've been talking about, when I was in medical school, I remember in the late 1980s, they were talking about putting statins in the water. I mean, and we've sort of moved on from that belief system. It's 50, 60 years old. And I think if we focus on metabolic health, however we define it, whether it's insulin levels, glycemic stability, or visceral fat, we're going to do much better. Do you see the metabolic health message making progress throughout the medical profession in Australia?
Yes, Sean. Because the message is getting loud. Because again, it is the patients, it is the public that's aware of what's out there. They're getting a lot of information. Like, at least like in Australia, they're getting a lot of information online from people like you, and from YouTube, from all those people in the the low carb world. The message is out there. What they want is someone local to support them, and people like me, doctors like me, our number is slowly growing. It's growing, and so the idea is to let that message get out. Let them know that we have doctors here in Australia to help them and guide them. And, all it takes one person in one family to do it. And the other family members will notice the improvements. The family and friends will notice the improvements. And the message is going to become louder.
Why do you think, and again, I think both of us recognize that there's a lot of ways to lose weight, but why do you think a low carb diet has an advantage for some people? What is the advantage, low carb, carnivore? What do you think is going on physiologically?
I think that is what we are meant to consume, Sean. We eat food that becomes us. We have to start looking at food as nutrition. Look, I want meat, I want fish, I want oysters, for a particular nutrition. This is how we should start looking at food. Looking at food as nutrition, and looking at food as so-called supplements to make us healthy and build our bodies. So I think that's the key, because that's why I'm telling my patients, start to look at food as nutrition the body needs. And everything else is, optional. And that's not what the body wants, but this is what the body needs.
Yeah, when I was in Malaysia, Malaysia is a bit of a melting pot. They've got a lot of different food influences there, so they've got a very diverse diet. There's a lot of consumption of sugar, and eating is a national pastime, I think. They're saying that they're having a lot of issues with diabetes and with the different influences. And so obviously there's a vegetarian influence from sort of the Indian subcontinent. How do we justify meat eating to, say, folks who's culturally have been kind of more plant-based? I know we've got some folks, say, like in India, that are now doing a carnivore diet, even though it's more challenging due to some of the laws are saying you can't eat certain types of food, beef in particular, based on religious prohibitions. But how do you because a lot of people, when you say it's what we're designed to eat, there's people who say, well, we've been eating a plant-based diet for 1,000 years. So how do we justify that meat is such an important part of the diet?
Oh yeah, Sean, that's a tough one. I have a few patients who are vegetarians for religious reasons, and look, I just try to be sensitive to their, their religious backgrounds or needs, and tell them. I mean, I do not advocate the carnivore diet for them, because I know they are not going to change their ways, and that's because it's a religious obligation for them. You know, they've been vegetarians since the day they were born. So with them, I try to focus on them avoiding processed food. I try to get them to avoid processed food. And if they are going to be vegans or vegetarians, I encourage them to cook their own food and use healthy fats for cooking, and just avoid processed food, because these people, their religious convictions are very strong, and like I said in the beginning, it's all about giving them options. And if that's the lifestyle or a meal plan they've decided to choose, I mean, as doctors, then we just have to help them do it, in a safe, healthy way.
I would imagine, if you can get these people to adopt healthy lifestyles, you stop seeing them as patients eventually. They don't need you anymore in some cases. Are you seeing that? Are you seeing that some of the patients are just going away now?
Yeah, I mean, so yeah, patients who used to see me frequently would now come in like once every 6 months or once a year. Yeah, you're right. So the healthier they get, the less frequent they see you.
Yeah, I don't think there's anything wrong with that. I guess, it might drive some hospital administrators a little bit. They might have some concern with that, with their patient volume flow, because they want to keep the hospitals full as part of their business model. But do you find that the food environment in Australia is there more emphasis on improving that, or is it just progressively getting worse?
Oh, it's getting worse. Yeah, there's no incentive here to eat healthy. There's a lot of attack on the meat industry, and there's a lot of negative press on the keto diet, the low carb diet. Almost every other week or every fortnight, there's some article in the papers saying, the low carb keto diet is going to stuff up your kidneys. Eggs are going to cause diabetes. Meat is going to give you colon cancer. Yeah. And who's giving out these messages? Some dietitians, and then you got messages saying why we have to move towards a plant-based diet, reduce our consumption of meat to save the planet, to reduce CO2 emissions. Again, everything is just so muddy out there, and as same probably in America, processed food is getting cheaper. This Uber meals, with this lockdown, Uber meals are becoming so a lot of people are turning to Uber Eats. And sometimes when I ask my patients to bring in their food diary, and I see all this food, they're like, what's going on here? Oh, Uber Eats there, Uber Eats here. So again, so we are making it easier for people to not consume healthy food. They're becoming dependent on fast foods, takeaways. People find it cumbersome to prepare a meal at home. So yeah, so it's not looking very good. But yeah, Sean. But I'm hopeful. Because our message is becoming louder.
Yeah, you think about what it requires to exist and procure food, these days compared to what it would have been, 100 years ago, 1,000 years ago, where you would have to catch your food, gather your food, prepare your food, butcher, whatever, store your food, then cook your food, prepare your food. I mean, there's so much more work that would have been involved, and now you literally don't even have to leave your couch. I mean, you don't even have to you don't even have to open your refrigerator. You can just, you might have to open your front door, but beyond that, it's kind of gotten kind of a bit nutty with all that. Let's see, I only have five more minutes, and I've got to go do it another meeting. But I'll tell you what, Sanjeev, can you tell us And again, thank you so much for being here. How do people find you? Are you on social media that people can follow you on, and how do they get a hold of you if they wanted to have you as your physician?
So I'm not great with social media, but I'm on Twitter, and my call sign is Lowcarb WA. WA for Western Australia, Lowcarb WA. And if you just Google Lowcarb doctors Australia or WA, my name seems to appear there for Western Australia. So that's how people can find me. And yeah, but I'm not that prolific on social media, Shawn. I mean, I'm still very old school, man.
Yeah, my prolificness on Twitter was recently turned away as they suspended me because apparently with the message I'm getting out there is not aligned with what they want to do. Hopefully we'll get that back. But any last minute words that you don't want to share for people that something you want to communicate to an audience?
No, pretty much. I always tell people that you know, if you eat, you know what they always say, right? Garbage in, garbage out. So if we eat good, healthy food, you know, our body will love us for it. You know, you live longer, live healthier, and you know, live a life without medications. We have forgotten that medication is not the only way to treat the conditions. Medicines were to supplement everything else. Our improvement in our diet, nutrition, lifestyle. And if that doesn't work for whatever reason, then you bring in the medications, not the other way around, right? So I think that message is, you know, has been lost or is getting lost. And yeah, Shawn. But Shawn, thank you so much for having me. I was really excited when one of my patients who went on a carnivore diet, lost, I think, about 35 kilograms. And she said that now she's volunteering for you and that we can do this meeting. And I was really excited. You know, I mean, it's an honor to just have this Zoom meeting with you.
Well, I appreciate that, and like I said, I think it's wonderful that we have physicians that are willing to get out there in the trenches and do the hard work. Because I know it's you know it's easier to go along and just continue to do the stuff, but the reward and the satisfaction I think wears off pretty quickly if you're just prescribing another metformin prescription. So anyway, Sanjeev, thank you so much. Have a great evening. Again, thanks for being up late at night. We could have done this at a better time for you. Let's do it again, and let's do it again down the road. We'll do it at a better, more convenient time for you, okay?
Yeah, sure. Thank you so much.
Okay.
Thank you.
All right, guys. Thanks, everybody. We'll see everybody tomorrow. If not, you guys have a great weekend, okay? Take care now. Bye-bye.